This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Cortirowa OD 9 mg tablet is an effective medication for managing various inflammatory bowel conditions. It contains budesonide, which helps reduce inflammation. Indications and uses. This medication is primarily indicated for the management of ulcerative colitis, Crohn's disease, and microscopic colitis. These conditions lead to chronic inflammation in the digestive tract, causing symptoms such as abdominal pain, diarrhea, and rectal bleeding. By controlling inflammation, it aids in alleviating symptoms and promoting healing of the intestinal lining, making it an essential treatment for individuals suffering from these debilitating conditions. How it works. Cortirowa OD 9 mg tablet works by blocking the production of chemical mediators responsible for inflammation in the bowel lining, thus controlling symptoms effectively. Directions for use. Always take this medication as directed by your physician. Swallow the tablet whole with a glass of water, and do not crush or chew it. The correct dosage and duration of therapy will be determined by your doctor based on your age, body weight, and specific condition. It is essential not to discontinue the medication abruptly without consulting your healthcare provider, as this may result in withdrawal symptoms. Possible side effects. Some common side effects include headache, stomach pain, muscle pain, and changes in mood. If these symptoms become bothersome or severe, it is recommended to consult your doctor. Precautions and warnings. Before starting treatment, it is crucial to inform your doctor of any existing health conditions, especially infections, allergies, or if you are pregnant or breastfeeding. The medication may suppress the immune system, increasing the risk of infections, so caution is advised. Patients with a history of heart disease, liver, or kidney issues should also discuss their health status with a physician. FAQs. 1. Can I stop taking this medication once my symptoms improve? No, always consult your doctor before stopping. 2. Is it safe for children? No, it is not recommended for individuals under 18. 3. Can it cause dizziness? Yes, dizziness is a common side effect. Rest and avoid driving if you feel dizzy. 4. Will it affect my blood sugar levels? Yes, it may increase blood sugar, so regular monitoring is advised for diabetic patients. Thank you for watching. If you have any questions or suggestions, please leave them in the comments below. Your feedback is appreciated.